Hi, Dr. Raj Kakar here, and welcome back to another segment. And today we're going to talk about what is sleep apnea. So I wanted to go into a little bit about what is sleep apnea so everybody has a good understanding of that. So sleep apnea is essentially a breathing problem that occurs during sleep that can cause quite a lot of sleep disturbance. And so sleep apnea is a breathing disorder that occurs because of breathing disturbance from the nose to the back of the throat primarily, which can interrupt breathing, cause disturbance in breathing, even cause pauses in breathing where somebody's struggling to move air for at least 10 seconds or longer each time. And sleep apnea can occur in both adults and in children. And in adults, again, it's characterized by pauses in breathing or absence of breathing or moving very little air for periods of 10 seconds or longer. In kids, sleep apnea is defined as having a similar decrease in breathing or absence of breathing for an equivalent of 2 breaths in children. And these episodes are repetitive, and that's what makes it so significant and why we call it a disorder, because it occurs frequently throughout the night, several times per hour. That's when it becomes a real problem for people. And so sleep apnea is oftentimes characterized by snoring, especially in adults. And so when somebody is snoring, which again, we all know is a very common problem, that could be a sign that somebody's struggling to breathe at night. That's essentially what's happening. They're having difficulty moving air comfortably while they're breathing, and that's what contributes to the snoring sound. So snoring is one of the first signs of possible sleep apnea. But what happens with sleep apnea is not only are they struggling to move air and causing snoring sounds, but again, if the airway, typically in the back of the throat, closes off or collapses, that can really limit movement of airflow for significant periods of time. And that problem tends to happen repetitively through the night, because once it closes off and collapses, somebody stops breathing, then that puts the body in an emergency state where the oxygen level starts to drop, blood pressure shoots up, and the heart rate starts to beat faster as a result of not getting enough oxygen to the body. And so then that causes increased effort of breathing until somebody gasps or wakes up and starts breathing normally again. And that happens because the airway tightens up. Once they wake up or they're disturbed from sleep, the muscles in the airway tighten up so they can breathe comfortably again. But again, if they're in sleep, that only lasts for so long, and then again things start to relax and collapse and go back to a relaxed state, and then again the process repeats itself. So that's what sleep apnea is, a repetitive breathing disturbance during sleep. The two most common problem areas that contribute to sleep apnea. People ask me, what causes sleep apnea? Well, I'll tell you. The causes of sleep apnea are primarily related to the size and shape of the airway. The airway is what contributes to this predisposition. And so people who have a narrow jaw or a narrow upper airway, which is really determined by anatomy, they are more predisposed to developing snoring and sleep apnea problems. And there are two primary areas that contribute to sleep apnea. The number one area is the soft palate and uvula that hangs in the back of the throat. That soft palate and uvula from the upper jaw, it relaxes while you're sleeping at night, and that can really interfere with breathing. The other contributing area that's very common and that plays a significant role, is the tongue, the back of the tongue. So as the lower jaw relaxes when we're sleeping at night, especially in deep sleep, the lower jaw relaxes, the tongue drops back further because the tongue is attached to the lower jaw. So as the lower jaw relaxes, the tongue drops back further and also plays a role in interfering and disrupting breathing. So those are the two common problem areas that contribute to sleep apnea. The soft palate and uvula from the upper jaw, the tongue from the lower jaw. And again, what causes that? Why are some people predisposed? It's really just, again, due to the anatomy, the size, shape of the jaw and the upper airway. And this is actually, unfortunately, very common. It runs in a lot of families from all around the world, and so it is a hereditary factor. Snoring and sleep apnea are hereditary. And over time, this problem with breathing and sleep apnea and snoring can get worse, unfortunately, with age. With age, typically we see a gradual progression of this problem. So that's one of the big factors as well, as age can make it worse. A big misconception in the sleep community and in the medical community in general, I should say, is even a lot of doctors think that weight is a cause for sleep apnea. That is outright wrong, wrong information. And so weight can contribute to sleep apnea and increase the severity or the incidence of sleep apnea. But weight in and of itself is not a primary cause in the majority of cases of sleep apnea. It may be in a small percentage, but large majority of cases are caused by the anatomy. That's what predisposes to someone. But if someone gains weight or is overweight or obese, of course, that can make things worse. And if someone were to lose some weight or get to a healthier weight, that could improve things to some extent. But in my experience of, over 15 to 20 years of experience now, most people who end up losing weight, even a significant amount of weight, if they have sleep apnea, it usually just doesn't go away. It may improve, but even after people who've had weight loss surgery, bariatric surgery, and other things, we do see improvements in sleep apnea, but a lot of times there's still some residual sleep apnea. So again, weight is not the number one primary cause of snoring and sleep apnea. So that's something to be aware of. And so that's kind of a summary of what sleep apnea is. And so next time in the next video, we're going to talk a little bit about why is sleep apnea important and why do we need to treat sleep apnea. So we'll talk a little bit about that in the next video. Thank you for joining me.